Hi, I'm talking today to psychosexual and relationship therapist Shanta Gyanchand. Shanta works both in the UK and in India. Hi Shanta, how are you?
Hi, I'm fine, Joanna. Thank you very much.
That's great. Thank you so much for agreeing to be interviewed for Askimo's International Library of Interviews with Experts. Shanta, today we're going to talk a little bit about psychotherapy. And the first thing we're going to discuss is, what is psychotherapy?
Well, psychotherapy is a broad term. It covers many different types of therapy, which are talking therapies, where you go to an expert who is a professional who's been trained to talk to you about any issue regarding emotions or psychological issues. And there are many different types of psychotherapy, and there are also many different expertise in psychotherapy. So you might go to a specialist, or you might go to a general psychotherapist.
For you particularly, what are the areas that you specialize in that people could come to you for help with?
So I specialize specifically in all areas of sexuality, anything to do with sex at all, and for relationships between couples, for individuals who may be having difficulties in relationships, for gay couples, straight couples, any relationships or therapy.
How is psychotherapy different from psychology?
That's a very interesting question. Psychology is the study of the human mind and human behavior. So a psychologist would do lots of studies or tests on people to see what their reactions are. Psychotherapists use those findings to help people in a practical way.
If I was coming to you for help, what would normally happen in the therapy session in terms of, would I be doing most of the talking and you doing the listening?
Yeah, well, there are different types of therapy, as I said, and different types have slightly different ways of doing things. Generally, the way I do things is humanistic-based, and that would mean that you would talk and I would ask some guiding questions. Generally, a therapist will ask questions for you to answer, and sometimes later on in the therapy, they might give some insights, which you could feed back and talk about.
How long are people normally in therapy for?
That's a question that a lot of people ask, and it depends on the type of therapy you're doing and what you're going in for and your own personal wishes, what you want to get out of therapy. With some cognitive behavioral therapy, you can just go in for 6 weeks and solve a small problem like phobia, like fear of spiders. That can be quite quick. And sometimes it can take longer, 6 months. We're, after all, changing patterns that have been in people's lives for a long time. So it's taken years to get where you are, so it takes some time to also change those things. And some people like to continue to see therapists for years, not always because there's a problem, but because they see it like going to the gym, continuing to look at themselves and improve themselves.
And what about medication? Is there a place for medication in the psychotherapy process?
I would certainly say yes. Different therapists have different ideas about this. I would certainly say there is that something, for instance, like antidepressants, that can be very useful along with therapy. If you're depressed, if you've gotten into a depression, there's usually some reason behind it, or some habits of thinking which aren't very helpful to you anymore. The medication can help lift you up enough that you can do the work in therapy and then slowly come off the medication. If there are other emotional issues, it can be very difficult to make work and progress in therapy unless you're on the medication you need to be on to stay stable.
Thank you, Shanta. Thank you so much for talking to me today.
And